The policy dialogue initiative considered as one of the most important initiative for our ministry, the Federal Ministry of Health, because it brings together all the partners, whether they are international partners or the local partners, including the civil societies and the international partners actually include the UN agencies and NGOs. This initiative has been initiated from the European Union, and not only they initiated, but also they supported by budget. We'd like to thank them for that, and it will base on 5 sectors. We as ministry doing jointly with the European Union to achieve all these 5 sectors, which will actually participate in promoting the health sector in Sudan.
تعتبر قضية السياسات من القضايا المهمة جدا بالنسبة لوزارة الصحة الاتحادية، باعتبار أن قضية السياسات من القضايا المهمة، وهي من إحدى اختصاصات وزارة الصحة الاتحادية. من خلالها تحدد الوزارة توجهاتها الأساسية بالتوافق مع الشركاء.
As part of the review of its national health policy, Sudan wanted to prepare a global health strategy to identify the issues to be raised at international fora and achieve policy coherence within the government in order to achieve better health outcomes for its population. It was an opportune time to do this in view of the development of the post-MDG agenda. This would allow the country to update its health policy to also include a whole-of-government and a whole-of-society approach, and would strengthen the health in all policies approach.
The whole idea from the World Health Organization was that health is not simply a matter that regards the medical staff. That health is the whole society's, every individual's concern. And as such, they advised countries to use all available resources and coordinate all activities in a sense that will help with the health policy.
The process to develop the global health strategy in Sudan has been fairly straightforward. We held a series of workshops and policy dialogues. First, we identified the topics. In doing so, we brought together experts across the different departments and sectors from all ministries to discuss the key issues for Sudan nationally and at global level. Second, building on this, we then held specialized workshops on the 4 key issues identified in this previous workshop, which were health and trade, health and environment, health security, and health workforce. Finally, the outcomes of all these workshops have been brought together in a draft document for the global health strategy. So in a final workshop and policy dialogue, we actually discussed this draft strategy and commented on it and received feedback from all the different experts, once again across all the ministries.
اجتمع لنقاش هذه السياسة عدد كبير جدا من شركاء الصحة، على رأسهم وزارة الخارجية ووزارة الرعاية الاجتماعية، وزارة الداخلية، وزارة البيئة والتنمية العمرانية، مفوضية العمل الإنساني، وعدد آخرين من الشركاء لتحديد هذه القضايا وتحديد موقف السودان في هذه القضايا.
The process of developing the global health strategy had as an immediate impact closer working relations and better understanding between the different ministries and stakeholders, and will result in policy coherence and clear action for diplomats of the Sudanese government to raise at different global venues.
The Public Health Institute conducted a review for the National Health Policy 2007-2011, and there was major issues which has been mentioned in the policy, but the implementation was weak. One of these issues is health finance, and we have to provide the evidence. So we conducted a review for the health finance system in Sudan, and we used the Oasis tool to make this review. And then we developed policy options for how to address the challenges which came out of the review. And after discussion with major stakeholders, especially the Minister of Finance and the Health Insurance System and Minister of Social Affairs, we concluded the specific policies which are needed by and that was a decision of the Ministry of Health. Now the Public Health Institute is working on to develop the strategy, that how we are going to implement these policies. And in all this exercise, we have been assisted by the WHO and the World Bank to achieve all these issues.
أيضا واحدة من الجوانب المهمة في إصلاح النظام الصحي هو إصلاح نظام تقديم خدمات الرعاية الصحية الأساسية. وفي هذا الإطار قام أيضا مع الصحة العامة بالتعاون مع الشركاء بتطوير سياسة لصحة الأسرة، وهي تتبنى المفهوم الجديد للصحة الذي يتحدث عن people centered health services والcomprehensiveness في provision of services. وأصلا يعني كانت هنالك بدايات لبرامج ماجستير في طب الأسرة، ولكنها كانت بدايات معزولة ومتفرقة عن بعضها البعض، وليس هنالك بينها رابط يربطها. وأيضا هي منحصرة فقط في مجال التدريب وتخريج كوادر طبية. لذلك كان من المهم الحديث عن سياسة شاملة تتكلم عن نموذج متكامل لصحة الأسرة وعلاقة هذا النموذج بالنظام الصحي وكيفية إعادة توجيه النظام الصحي وإعادة ترتيبه بحيث يستقبل هذا النموذج ويعمل على دعمه وتنفيذه على أرض الواقع. كانت هنالك سلسلة من ورش العمل أيضا امتدت لبعض الناس، يعني بعض الجهات التعليمية والتدريسية كلهم يعني انتظموا معنا في مجموعة عمل عملت على نقاش الجوانب المختلفة لهذه السياسة والخيارات المتاحة أيضا أمامه. وتم أيضا عقد ورش بمشاركة الولايات عن النقاش حول هذا الموضوع والتداول حوله، وخلصنا أيضا إلى ورقة تلخص هذه الخيارات، وتم النقاش أيضا مع وزارة الصحة، وهي الآن في الطور النهائي لإجازة كسياسة من وزارة الصحة.
الانطباع اللي انا شفته لغايه دلوقتي ان البوليسي صراحه مكتوبه كويس جدا جدا من ناحيه السيتويشن اناليسيس بتاعها والفيجن بتاعها والميشن والى اخره والكونتنتس حقيقي فعلا كويسه، بس it needs to be more focused بعد كده ان احنا what exactly are we going to implement ونحطها in a phasing approach بحيث انها تبقى حقيقي reflect reality.
One of the other issues which also came out is how to really implement prevention and promotion. And it is clear that also prevention and promotion is not only the task for the Ministry of Health. That is why we again assessed the current situation concerning the intersectoral collaboration which is taking place between the Ministry of Health and other sectors, and also with between the Ministry of Health and the civil society. And from that study, we made a discussion and a workshop where, in fact, a large number of sectors attended that meeting. And in that meeting, we discussed what are the issues and what are the challenges and how we can address them. And we came out with a roadmap of how to implement health in all policies. And this notion of health in all policies has been presented in the workshop, and so many sectors has been very enthusiastic that they can really contribute to this and be part of it. And they highlighted very important issues which are happening in their sectors and their ministries. And the roadmap to the health in all policies is going to be implemented in a manner where all stakeholders are going to be part of this implementation.
The policy dialogue was I believe it was very interesting, and it was very vital, and so many people participated in it. I would say the first result of that one was to raise awareness of different departments at the importance of having health at the forefront of their programs and plans that will incorporate health in their programs usually.
لم تغفل هذه الرؤية لتطوير السياسات أن تناقش أيضا السياسات من ناحية كيفية إيجاد نظام موحد لتكوين وتطوير هذه السياسات، لأن ذلك يساعد في أن تكون السياسات كلها سياسات معترف بها، سياسات لها جانب كبير من المصداقية والشفافية، سياسات يمكن لكل الشركاء أن يحترفوا بها وأن يؤمنوا بها وأن يمتلكونها لكي ينفذونها.
Again, during the review of the national health policy, it was clear that there is a problem also in the policy system. How the policy is formulated, implemented, and followed up in the overall system. What are the different elements of this system? So we developed, conducted a review also to the current situation, and we came out with a frame which have identified the elements of the policy system in Sudan. And we also conducted another study, and we came out with recommendations how to strengthen the different components of the system. That means to strengthen the governance, strengthen the role of the stakeholders, and strengthen the process itself.
As WHO, it was a pleasure to work with the Ministry of Health and other ministries in this process, and we were able to support it by bringing in renowned international experts to support the workshops and debates in country.
The pilot project that was arranged by the Federal Ministry of Health and Ministry of Foreign Affairs is a very good experience for all departments to take together things and bring departments that have to do with the same activity of the department in a way that will raise awareness in other departments of the importance of this dialogue, and to formulate policies that will be in line with each other, which will help in the final analysis in the service that is given by a department.
نحن نعتقد أن طريقة إيجاد منبر للحوار لتطوير السياسات قضية مفيدة جدا، قضية استطاعت أن تحقق إجماع حول قضايا السياسات التي طورتها وزارة الصحة، قضية استطاعت أن تنتج لنا سياسات مبنية على البراهين ومبنية على التجربة المحلية.
I think the way forward is mainly governed by what we have did just till now. I think now we have 4 or 5 policies which has been developed in an inclusive way, and these policies are going to be presented to the National Health Coordinating Council, which is chaired by the President himself, and this is a very important forum. We are now left with 3 major areas which we need to work on in the future. One area is that we have some issues which was planned during this year, and we have still November and December we are going to finalize this, like the family medicine policy, for example. And we have some issues which these are questions which have arisen during the review of the health and all policies or review of the health finance, and we need to make special studies for these issues so that we can answer them and feed into the general evidence of the issues, of the topics. The third area is that, in fact, these issues of finance and health and all policies, they are the streams of the national health policy, and we need to bring these streams together and complement it with other streams which are not yet addressed, and make them all integrated in a national health policy. So the national health policy will be one of the important issues, topics which we are going to address in the next round of the program.